Hey everybody, welcome back. It's Dr. Mivi Singh, your emergency medicine specialist. Today we're going to be looking at some important things about how to keep yourself safe as doctors, especially when it comes to writing notes. This is one of the biggest areas that people keep making mistakes. Firstly, let's have a look at one of the big things. People do not even write their names. Don't put their name, who they are, and the time that they saw the patient. This is so crucial for two obvious reasons. Firstly, people got to know who you are. Who was the doctor that saw the patient? Secondly, the timing that you saw the patient is crucial, because did you see this patient rapidly at the point that they were deteriorating, or they were urgently asked to be reviewed? Or was this a patient who was seen afterwards because there was delays or something else of that nature? Luckily, for a lot of hospitals and GP settings out there, everything is mainly done electronically. So you won't have to worry about putting your name, the date or the time, but there's still a lot of places out there that utilize paper notes, because when something goes wrong, they're gonna come looking for you. They're gonna look for why this person was not writing the notes accurately, why they didn't document their name, and it can look potentially suspicious. Also, it's just about good medical practice, which is keeping good notes, keeping contemporary notes which are up to date. It sounds like such a simple thing, but actually many doctors fail to do this, and when there's a problem and people start digging into the notes to find out what exactly happened, that could actually be a serious detriment, and it could be a problem for yourself. You could remove all these types of issues just by simply doing the basics. So remember, put your name, write the date, put the time as soon as you've seen the patient. Easy as that. Another huge mistake that doctors make is they don't write their name or their GMC number or the timing of when they want their medicine to be given. This again is just part of basic good medical practice, the basic things that a doctor should be doing. People need to know who wrote the prescription. People need to know the time it was written. A lot of the prescriptions have a place where you can put your medical number. In the UK, we call this the GMC, the General Medical Council number, that all doctors are given, which is a unique identifiable number, which is in respect to each individual clinician. When it comes to the nurses and they are going to actually give the medicine, they need to know what time it was given. And that is because when something again goes wrong or there's delays, people need to know when was the decision made to give the antibiotics. When was the antibiotic then actually given? So was there a delay or was there not a delay? This helps in problem solving in those difficult circumstances. Put it this way, you do not want to be blamed for when things go wrong and then they say, nobody ever told us what time the antibiotic was meant to be given. When you have that written down with the timing, you have not only covered yourself, but it just means that you've done the basic, simple job of keeping your patient safe. If you see it in that angle, that you have done the basic job to keep your patient safe, you cannot go wrong. Another huge area where doctors tend not to prescribe or put their name or anything like that is for the oxygen prescription. Oxygen is a drug. It is simple as that. So you put your name, put the date, put the time, put your GMC number. It is a drug, so prescribe it. And most patients do not need to be on oxygen, and therefore those that do require it should be prescribed it. One of the other key areas where things are missed is when you review a patient, most doctors do not document that they have re-reviewed a patient. They leave the simple first notes, they do not put the re-review. Now that is key. You have to put down that you reviewed a patient, even if you had a little chat, you spoke with the family, or you saw the patient in passing and you saw them doing something different compared to what they were doing before. For example, if you have a patient who before was reduced alertness level, and now you see them walking up, going to the bathroom, eating, drinking, all these types of things, it's important because that is a type of interaction, a change in the patient's clinical condition that you can document to show that this patient has improved, or on the flip side, if they deteriorate. So if you have a patient who was before talking, looking well, good color, and now they have deteriorated, that is important to document because again, it shows the patient's journey. And then you write exactly what the intervention was, if there was deterioration or if there was positive news and they've got better, what you did as a result of that. For example, change of the plan, discuss with the family, potentially looking at whether this patient could go home, withdrawing certain treatments because they no longer need it. Anything of that is very useful for the patient's journey, the patient's documentation, because it paints the true reality of the picture. People think it takes a long time to do. No, it doesn't. It literally is a 30-second job, and it's easy to do, and it shows that you're a good doctor. Because remember, if it's not written, it didn't happen. That's the rules in medicine. Another massive area where doctors do not document is who they spoke to from another specialism, from another field, within another hospital, or relatives that they have discussed things with about the patient. Putting names, who the person is, the timing, the date, their position, their specialism. So these things are really key. For example, if you discuss with someone from another specialism and you took specialist advice, you got to write their name down, their first name, their last name, their position, and what the advice was as they gave it. Luckily, in certain situations and certain circumstances, we actually do written referrals. So these are online referrals, and that helps us out so much because it's very good documentation, because it actually has their names and our names and the true discussion as it happened, so no one can rebut what exactly was said and what was the action plan. Unfortunately, for inter-hospital discussions, inter-team discussions, those things are not in place, so you have to formally write that down. So make sure you do it accurately, because again, it shows good patient care, it shows good documentation, it shows that you're practicing medicine to a very high level. But also, if again something was to go wrong, it means actually you did the best thing for the patient, and that's evidence. If you've not written it, nobody's going to know exactly what was going on. Nobody's going to know the discussions. Nobody's going to know that you actually did the right job. The reason why a lot of doctors forget that part is simply because, one, they simply forget. Two, there's time pressure. Three, they're actually afraid to ask someone that they've not spoken to about their name. Remember, there is nothing to be afraid of. And also, if a person is requested for their name, there should be no shame and there should be no fear in giving it. For example, if anybody asks me for my name, I'm 100% happy to give it. I'm 100% happy to give my GMC number, because I practice medicine to a high degree and I want you to do exactly the same. There should be no fear if you are practicing good medicine. Well, I hope you liked that short recap. I hope it was good. Hope it was interesting. My name is Dr. Mevi Singh. I'll catch you all next time. Stay tuned. Remember, make sure you like, share, subscribe, and I'll catch you all in my next video.